Welcome back to Daytime Ottawa, a great opportunity to raise awareness when it comes to psoriasis. And it's something I'm sure all of you at home have heard, but did you know that it greatly impacts family planning? And here to tell us more about it, I'm joined by Dr. Jennifer Lipson. Dr. Lipson, welcome to the show. Great to have you here.
Hi, thanks for having me, Derek.
Let's talk about, first of all, in detail, what exactly is psoriasis?
So great question. Psoriasis is a chronic inflammatory condition that affects the skin of about 2% of the population. And what a lot of people don't realize is that some patients may just have mild disease, but it can be quite extensive and actually debilitating. It can affect the hands, the feet, be thick, cracked, fissure, and really affect patients' physical health and mental health. Another thing a lot of people don't realize is that a lot of people with psoriasis will go on to have other conditions at a higher rate. This includes a specific type of inflammation of the joints called psoriatic arthritis, as well as higher rates of diabetes, high blood pressure, heart attack, stroke, anxiety, and depression, to name a few.
Is it fairly easy to diagnose, or can it sometimes be a little difficult because somebody doesn't even realize what it is that they have?
I would say that the majority of family doctors and definitely dermatologists are pretty good at recognizing it because it has a pretty typical appearance for the most part. Red, scaly plaques. It typically affects elbows, knees, scalp, but can really be anywhere in the body. But it does have a pretty typical appearance usually.
As I mentioned off the top, it can certainly impact, family planning. We're just having a look at what it could look like here. And there's, some of the latest studies out there certainly talking about chronic inflammatory disease, which this is. Does it impact women more than men, and how does it impact family planning?
So it probably impacts women and men in a similar degree, but in women, the peak onset of psoriasis actually coincides with peak reproductive age. Okay. And what's important is that a lot of women, it affects their plans for childbearing. About 40% of women will delay having a baby because of unmet concerns about their skin condition. Sometimes they're worried about passing on to their baby. Sometimes they're worried about how their decisions for their treatment will affect the baby. And we actually know that almost 40% of women will stop their treatment without speaking to their specialist because they're worried about how their treatment will affect their fertility and how their treatment will affect the health of their baby. And it's unfortunate because we actually now know, and we have a wealth of information, that there are very safe and effective treatments for women of childbearing years.
Dr. Lipson, for somebody that is, for instance, isn't getting treatment, can it affect the child? Can it be passed on to your child?
So there is a hereditary component to it. About 30% of patients who have psoriasis have a family member with psoriasis. So if you have it, there's a higher risk of your child having it than someone who didn't have it. But as far as how psoriasis can impact a pregnancy, there is inconsistent data showing that women with psoriasis may have more difficulty getting pregnant and may have higher rates of miscarriage, cesarean section, and small or large for gestational age babies.
When it comes to treatment options, are those options, do they differ if a woman is going through pregnancy?
They definitely do. There are certain treatments, both topically and systemically, whether we pill or injection, that we would not use in pregnancy. And then there are certain ones specifically that we now know are very safe to use in pregnancy and in breastfeeding as well. So what we really want to get across to our population is that it's so important to start the conversation with your specialist if you have one of these chronic inflammatory diseases like psoriasis, just to talk to us about your plans for childbearing so that we can come together and come up with a really good and safe treatment plan for your future.
If somebody's watching now and they perhaps they don't have contact with their doctor, or they can't get in for a bit, are there resources available? Is there information out there available?
For this very specific niche, pregnancy and psoriasis, it would be best to speak to your specialist about it, speak to a dermatologist and get a referral to a dermatologist. But in general, there are some really great resources for psoriasis out there. You can go to the Canadian Derm Association website or the National Psoriasis Foundation website, and they have great information on psoriasis. But it's pretty specific when it comes to pregnancy management of psoriasis during pregnancy, and it is really important that you do speak to your specialist about these plans and what treatment options are available for you.
Excellent. Really appreciate you spending time with us today, Dr. Lipson. Thank you very much for raising awareness, because I think a lot of people, they didn't see that connection when it comes to the impact of family planning and pregnancy.
Yeah, thank you so much for having me. Have a great day.
Thank you. You too. Don't go anywhere, because coming up after the break, one of our colleagues here at Rogers over at KISS 105.3 FM is going to be joining us, and he's going to be participating in a marathon, but it's a marathon unlike you've ever seen before, probably. And if you're a gamer, whether that's video games or you love board games, you want to stay tuned for this, because it's also raising funds for a great cause.